Well, hello, I'm Dr. Ruth Roberts. I am the host for this Holistic Dog Care Summit, and I am so delighted you are here with us. You may know me as the original holistic pet health coach, and indeed, my focus over the last 34 years of practice is to learn the best way to support dogs, and the last 20 of those using holistic uh, tools and techniques. And I am really excited today. With me is Dr. Jeff Feinman, Dr. Odette Suter, and Dr. Susan Bohrer. This is sort of an interesting mixed bag of people, but I hope what you'll see is how these topics and themes sort of connect to each other, and that really, if we let go of one part, other parts in the body fall apart. So, Dr. Bohrer, I'll start with you, and if you could introduce yourself and give a brief intro about what you'll be discussing in the summit, that would be amazing.
Great. Well, hi all. I'm Dr. Susan Bohrer. I know I've met Dr. Odette, and I just meeting you, Jeff. Nice to meet you. Ruth, you and I have talked a lot about food and the importance of nutrition. My background is I'm a small animal veterinarian in Southern California. Practiced integrative medicine, Western and Eastern, for about 15 years. And I really started to focus on Eastern medicine's arm of food therapy when I started to do some light recipes with my patients, and then started to see incredible improvements when I just got these dogs and cats off kibble and on real food. So that was really kind of changed my practice, to be honest, and made me really focus on food, the quality of nutrition, and just started thinking if we could just change the foundations with their food and really see food as, the first medicine, we could really improve health. And especially with so much chronic inflammation that we're seeing in our animals, a lot of so many allergies and all this kind of built up chronic inflammation has really benefited with a traditional Chinese medicine approach that focuses on whole foods. So that's kind of why I started. I launched Chi Dog to make diets for dogs, and I continually talk about the importance of real food in our patients.
Thanks. And that is so true, so true. And Dr. Odette Suter, if you could introduce yourself and talk a little bit about what your specialty is, if you will.
Yeah, hi, I'm Dr. Odette Suter. I'm a holistic veterinarian, and people always ask me, well, how did I get into holistic medicine? And I always tell them I was born weird and just grew weirder. So I already grew up, more holistically oriented, just from, my parents. They kind of introduced nature and natural healing modalities into life. And so it was very logical for me to kind of continue in that direction. And, in vet school, I recognized very early on that it wasn't really that helpful what we learned, in the sense that it gave us a good basis, but it didn't really provide us a lot of information on how to actually truly heal animals. It was just more antibiotics, steroids, and painkillers and surgery. So that naturally then dove me further into holistic medicine. And then my own health journey, obviously, pushed me even deeper, because I had no idea what all was there. And so I got the deep dive on a very personal level. And so I apply, obviously, all of that, what I've learned, to my animal patients. And I love educating people, because I feel that that's really where the power lies. And I love supporting pet parents in their journey, and, guiding them and really providing them with what I think is a bit of a shortcut, because that's a bit what I learned in my own journey, is that if you use the right things, do the right things, address the right systems of the body all together, then you actually get much faster and better results than chasing after symptoms and adding one supplement or another. So that's what I do, is I educate people on that, so that they too can have, faster healing for their animals.
That's amazing. And it's astonishing to me how many of us come to holistic medicine because either our own diseases or our pets' diseases have become our teachers. So thanks for the vulnerability and sharing that. And Dr. Jeff Feinman, please introduce yourself and explain what you're doing.
what am I doing?
What are you doing?
I don't know actually. My name. I do know my name is Jeff Feinman, and I've been a veterinarian and molecular biologist, which is my first training since 1985. So I've been doing this 39 years now, and I was a conventional vet. Actually starting to specialize in internal medicine and endocrinology and aging, and that lasted until the 90s, when I began to realize that there was more than we were taught in vet school. And my life since then, so 20 some odd years, has been exploring this paradigm that connects everything. And that's really the bottom line. And that's, body, mind, spirit, and how what we learned in vet school was really just a small part of what we need to know to help our beloved animals. And what I do is, past 7 years, realizing that you're not going to get this another way. Past 7 years, I've been educating pet parents, empowering pet parents via an online platform called Holistic Actions, which is just a place to learn all the stuff that I learned over 50 years of that my own undiagnosed symptoms and diseases. I guess maybe we'll get into that later, but that's who I am right now, health-ish.
In this very moment, yes. Dr. Susan, your topic is entitled Traditional Chinese Veterinary Medicine Digestion. And that is like mind-blowing. So can you talk a little? It's like, wow, how did they get to this stuff? But can you talk a little bit kind of about what you'll discuss during that topic? Yeah.
Absolutely. So when we talk about integrative medicine and Eastern and Western medicine, we all understand Western trained veterinarians. We're all trained here in the U.S. Under the traditional, principles. When we talk about integrative medicine, holistic medicine, Eastern medicine, there can be some different things, but in general, the traditional Chinese medicine approach is veterinarians who do acupuncture, who use herbs. Not all, but some, and then also use food as medicine. So we talk about food therapy. So the same way we use specific herbs to help, with imbalances in the body, we can also use food in the same way. So we have herbs that cool you, herbs that warm you, and so we'll have I will have foods that cool you and foods that warm you, and so we use those as well. And so really what we try to do, so that's where traditional Chinese medicine and how we approach the what we should eat and see it as part of health. And specifically when we think about how or what does the tenets of traditional Chinese medicine say about digestion, right? Because it's kind of, we understand how important digestion is into our health. And Western medicine is starting to kind of wake up that like 70% of our immune system is in our gut. Like our gut really matters, what we're putting in. And that's kind of, makes sense. We all know that, food is the medicine we take every day. Chinese medicine has said, we should always start with quality ingredients, right? So we should always be thinking about, what's the quality of this ingredient? We should start with a baseline of good quality ingredients. And that means whole foods, right? That means actual food rather than processed food. Processed food, like some of the, it's like some of our dogs and some of us, the people are eating. Processed food is when you break it down and then you reform it into some other form, it's processed. And then when you put that in the body, it takes what that processing puts heat into the body, puts dryness into the body, puts something called damp into the body, which is kind of like the precursors to things that can cause tumors. So when we start to see these accumulations of processed food, we have lots of heat, lots of inflammation, right? The other way, and we see lots of tendencies towards tumors. That's well understood for human medicine here in Western countries, where we understand the importance of our food. We just haven't made that same connection for a lot of our animals. But traditional Chinese medicine has always understood that the quality of the food you eat matters. And that's where, obviously the digestion that our body has to do to keep us healthy really matters what kind of food we're putting in it. So that's really the basis of traditional Chinese medicine. And that's why a lot of the holistic veterinarians are making recipes often. recommending whole food options, because we're understanding the importance of the quality of the food we eat and how it impacts our gut. And so we're really just trying to focus on the quality. It's kind of baseline.
It is, and so sadly understood. And I think until really in Western medicine, until functional medicine started to gain ground in the US, that was when conventional medicine was like, oh, you mean it really does matter what we eat? And yeah, so functional medicine brought that concept of if your digestion is not working, nothing else will work. And to that end, Dr. Odette, your topic is called Microbes as Key to Fighting Pet Cancer and Boosting Immunity. So can you give us a quick rundown on what that's going to be about?
Yeah, so we discussed, how the microbiome and gut health in general plays a role with cancer development, prognosis, response to treatment, and it's really complex. I did a bit of a deep dive, went down a bunch of rabbit holes because there's a lot of information that's coming to the surface, and I want to preface it with the information that we're all gaining now with all the research, especially into the gut and microbes that's coming out, is not. It's all great information, but we already know what we need to heal things. So I want to kind of preface that although there's exploding information that's coming our way, that we don't forget to actually look at the big picture. And just like Susan said, Chinese medicine is like thousands of years old, and they already looked at all the different aspects that are necessary for health. And so when we look at cancer, we definitely want to focus on nutrition, but also then focusing on what the gut microbes do. And they're certainly taking a bit of a beating with the environment that we live in, the glyphosate, the spraying of all sorts of pesticides and antibiotics, et cetera. And so with that, we end up with an imbalance of that microbiome, which is all the good microbes that live in and around us and that help us make good nutrients. Like they help us digest nutrients. They help make certain nutrients that we need, like B vitamins, for example. And so with all of these microbes, because there is such an imbalance, then it creates an imbalance in the entire body, which then sets the stage for things to go wrong with the immune system in particular. And when the immune system is going a little wrong, that can result in allergies, autoimmune diseases, and then cancer, of course. So we need to really set the stage with a healthy gut to then be able to prevent cancer, but then also help once it shows up, if it shows up, that so that we can do something about it and help support the body. And so looking at microbes on that level is really important. They've done quite a few studies in humans, especially one of them that stood out was on pancreatic cancer. And they found that if the microbiome was much better balanced in these individuals, that they had a much longer survival time. So from 1.6 years to 9 point something years difference, which is huge.
Amazing.
Yeah. So
I mean,
anyways,
that's the holy grail, because that diagnosis is one of the most horrifying to hear on the human side. So to get that kind of shift in survival and hopefully health span is astonishing. But the key word is imbalances. And I think that's one aspect of veterinary practice that we've been sorely missing. And so Dr. Jeff is talking about spiritually holistic health approaches. So Dr. Jeff, can you tell us a little bit about that?
Sure. My little video kind of tries to tie it all together as far as spirituality and the interconnectedness of life that is seen via vitality and the balance of our animals and what we can do to keep that as good as it can be, keep it as the universe and as nature wants it to be, which is in balance. And I guess the main thrust of my little video was symptoms, that symptoms are clues to what spirit and nature wants us to do to help our animals, and that symptoms are not there to be suppressed or run away from, but rather to be embraced and actually cheered as clues to what to do next. And we'll talk a little bit about what a few things that we can do to proactively prevent disease and to monitor and treat it. From looking at the bigger perspective that hopefully we're all bringing in, whether it's Chinese medicine, Ayurveda, or the balance of the microbiome may be the best physiologic example of the balance in the body.
Well said. And so I hope now that you, the audience, are getting the connection between these three panelists and their work. Really, in different ways, they are each seeking to help bring balance to the body so that you can take that information, apply it to your pets, apply it to your own lives, and improve the quality of life that your entire family is experiencing. So, we've talked a little bit about what you're talking about, but in terms of how this would support pet parents, how do you as we're sitting here in this virtual room, how do you feel that all of these things are interconnecting to support pet well-being? And that's a pretty broad question, but I'll let you all take a stab at it. So,
Well, I'll start because I was noticing when you were talking, Dr. Odette, about microbiome and about how when things get out of balance, we start to see, chronic inflammation and, and risks of cancer and those types of things. And I was thinking about, that's exactly how I think about it, when we think about it from a Chinese medicine perspective, but, we'll describe it like, I'm sure, like we'll talk about a qi deficiency, right? Or there's, CC phlegm or just not different words to describe the same sort of chain of, when we allow ourselves or when we, due to necessity or due to whatever, we start, we have, eating the wrong thing and the microbiome, gets out of balance. And it's just kind of, then we end up with chronic inflammation, which sets us up for, cancer risks and all those and obesity and all those other things. And so it just thinks it's interesting. It's kind of the same, sort of pattern described with different words, that really kind of makes us see that we're just, we're seeing the same pattern in different disciplines describing it differently.
yeah, and that never were truer words spoken. And I think we get lost in the semantics sometimes and fail to see the overarching concept.
Yeah, I always say, let's go back to basics. When I talk to them, they go off on tangents. I'm like, no, let's bring it back to basics because that's where true healing is. And we already know it all. Our grandparents already lived by that. They exercised, they rested, and they ate. I mean, exercise, they worked hard out in the fields. That was their exercise. But those are like the basic things. And then you get everything with that. You get a good microbiome because you're out in the fields, you're getting microbes, you're outside. You're not stressed. The animals aren't as stressed. So then they get more relaxation in the gut. They can absorb and, process the food better. And then they can also have a better microbiome because stress affects that too. And so it's like this whole picture. And we just need to bring it back to this whole picture because that's what I feel is very often missing. And then obviously the spiritual, emotional aspect of looking at, well, this is happening in my life. What do I do with it? And why is it?
Yeah. Yeah.
Yeah, absolutely. Sometimes we're looking for like the one thing that's gonna fix it. I can get that one, thing, and it really, you're right. It's not. It's everything. It's how you think and how what your day is and what you eat and all that.
That's how people end up with supplement graveyards, and their animals are still not any better. And like, yeah, well, let's scratch all of these off and let's just see what we need to basically, restore things.
I had my goal is 3. I don't know what yours is, Dr. Jeff, but they 3 supplements. I can't do. But beyond that, they may be all amazing. 10 could be great, but you really body can only take up so many. So it is, you get to kind of pick which ones are most important.
Yeah, my rule of thumb is less is more. I mean, if we can deal with good food and a good life, that's the goal. And how the interconnectedness that you're all talking about is, I think, the basics that we want to empower our pet parents with, that they're all overwhelmed by, all the information. And the reality in my world is that it's not about the information. It's about the wisdom of the thousands of years of healing that our ancestors, by eating well and exercising and being interconnected, live long, happy health spans. And, our animals, I mean, when I was in vet school, you didn't put cancer on the differential diagnosis of a 2-year-old dog. And now, we're seeing 2-year-old dogs, we're seeing 6-month-old dogs with cancer. And and it all does go back to inflammation, because everything goes back to inflammation, because we wouldn't be alive. Our animals wouldn't be alive if it weren't for information. But if it gets the wrong information, then that inflammation is misdirected, and that's what we have to deal with. It's not the inflammation necessarily, but the direction of that inflammation. And I just want to say one more thing about what you said, Dr. Odette, because it's so important. That's language. Actually, I guess we all said that, because the language of traditional Chinese medicine, language of Ayurveda, language of science, they don't necessarily compute with the APO, as Chen Bridwell would call them, average pet owner. She calls them owners, but I think that we deal mainly with guardians, people that are guardians with their beloved animals. And I think it's really nice to have a simplified language that integrates all this, and that's the vitality and balance system that we've been working on for a number of years. And I think that we can do it. I think VetMed's going to look very different in a decade or so.
I 100% agree, especially when it comes to nutrition, because remember what you said, it not information, it's wisdom, because that's true. It is kind of like, there's things that you kind of, like you said, like the way our grandparents used to, we're kind of going back to that. And there's kind of a gut check, where it's kind of like, for example, we all talk to people who have dogs who have specific medical needs. Well, my dog, needs a low fat diet. Like, how do I do that? And without buying a bag that says low fat on it, like, and like, well, think about it. What's low fat? We want to feed them, protein. So, okay, chicken and turkey, those are leaner. That's low fat for a good whole food. An egg, even leaner than that. A low fat, egg with the yolk, because you got to have some nutrition in there, right? Those, or if you scramble an egg, you've got a low fat whole food, protein, right? Like, and it's kind of like, we forget that common wisdom, because we're so wrapped up in the reading of the back of the bag, and with, it's kind of like, oh yeah, I could make a scrambled egg. You know what I mean? That's like, so I find that again and again, that we forget how, we would think just your, with your own, with food, if you're talking about whole foods, you can just think about the food, and it really makes it easier. It's, I'm sure you guys have had the experience, so rewarding when you can make something for your pet, and, it makes them, and that's just a goal,
Yeah, and that was one of my main goals with this summit. Is there's so much information out there, and it's so overwhelming that people really don't even know where to start. And so the big goal for this summit was to give people very simple, very actionable information that they can start saying, yes, that idea works for my dog, or no, that idea doesn't work for my dog. But have the space between the next breath to say, take that little pause, and have the information, the guidance, the wisdom drop in and say, wait, no, I know chicken doesn't work, but yeah, scrambled egg might. So I'll try that.
Exactly. Yeah, you're right. Everybody knows something more about their dog. They know my dog's allergic to turkey. Okay, let's find something else that they're not. You're right. It just kind of piecing through the information to find the wisdom, I think it's kind of a good way to think of it.
Yeah, there was a integrative veterinary diets, which has long since been bought by somebody else and turned into God knows what. But they had a wonderful ad campaign, and it was a photo of a strawberry, and the text was, if you were allergic to strawberries, you could produce an engineered hydrolyzed protein, or you could just not eat strawberries. And so that's kind of what happens is with all of the information and the thoughts we have available to us, we get lost in the high tech end thing of stuff instead of just looking at what small, simple steps can we take. And that's why I love what each of you are doing.
Right.
Yeah, and I mean, it's also dogs, for example, they know exactly what they like and what they don't like. They will tell you, yeah, I'm eating that, but no, I'm not eating that. And even, obviously they call me the Dr. Poop Lady. So I also look at, how do they behave naturally? What do they do? And I have one client who has 13 dogs now, and one of them eats poop, but he will only eat the poop of those who are emotionally balanced. And when one of those emotionally balanced dogs got a dental, he was not eating that dog's poop for a few days after the dental. So they're extremely smart. They know exactly what it is that they need. And I know everybody's probably like grossed out by now, but we need to listen to our animals, and we need to listen to our own intuition and to, as you mentioned, the wisdom, because I think that's where most of the answers really lie. And I think that
let them weigh in. Let them weigh in.
Yes.
Yeah. And I think we're also in a stage of development and growth, evolution, on this planet, where we go from having someone tell us what we need to do to trusting what we know and what feels right to us, where we are then more empowered because it becomes more our choice in that sense. And we feel better about that. And I think that is a big part of what's happening on this planet, is that there's a lot of change happening. Very uncomfortable. Humans don't really like change, but still it's happening and it's beautiful, but stressful for a lot of people.
No, that's true. Like when you said talking about letting the dogs kind of like listening to them a little bit, I find that too, because I talk to a lot of pet parents when they come to their diet and my dog doesn't like that, but I try to make him eat it, and I put something else on it to make him eat it. And I'm like, oh, listen to them.
No.
Listen. It's okay. I would say they should love three things. They love you, they love their walks, and they should love their food, right? Like those things, all those things should be joys every day, So that's on like, if they like it. So if they, if you can find something, obviously we're not going to feed them a plate of bacon, right? But healthy foods that dogs can really love, and that can be super gratifying,
Yeah.
Dr. Jeff, I can see you itching. Jump.
Yeah, and I need to go back to the poop.
Yeah. Of course.
Because Odette gives such a beautiful example of the interconnectedness and the energetic interconnectedness of our animals that are like canaries in coal mine. That dog that stopped eating, the dogs that had the dentals poop stopped eating because he knew it was good for him, not necessarily because he didn't like the poop anymore, but he could sense that there was that energetic imbalance that was induced by the dental, by the anesthesia, by the drugs, by the stress. And I think really it's all about getting that balance back in line, and we can do that by doing exactly what Sue said, by focusing on those three things, because those are the three joys that we know are going to realign physiology and the microbiome better than anything else. The reality is that if our dogs ate what they loved, if they got their sniff walks and plenty of playtime outside, and they got their unconditional love with their parents and other dogs, and other animals that if we stayed out of the way, if we just let them stay in their joy, they would be as good as they could be for much longer than they are at this point. I mean, again, the 17-year-old, 18-year-old Great Dane was not unheard of in the 60s and 70s. Perhaps that was because we weren't intervening quite as much. But how many of us had grandparents or great-grandparents with 25, 28, 35-year-old kitty cats? Now, we hear all the time that a 10-year-old or 12-year-old cat's an old cat. Not so much. That's middle age.
That's true. And we can't change the air, we can't say we can try and change our water, but there are some the climate, that we live, but we can definitely impact what food and what, and their daily lives, right? Just like our own.
Yes. And that's, I think, critical too. I mean, Susan, you mentioned the three things that bring joy. And literally, if we are working to make the dog follow the program instead of what brings the dog joy, then ultimately we disturb our own joy. And I think that's a big part of it. Ohio votes for that. But that's kind of it. We're so caught up in the masses of information and trying to wade through that and trying this and trying that, we forget to stop and breathe and just really be happy that they're here with us, that we get to share this journey with them. So I mean, it's just so important.
That's true. Because a lot of it, I think there's a lot of both stress and just, so much information, and also fear, like they're fearful to change something, or I'm fearful to try something new. Because we all put that, because we love our animals. If there's something going on, there's something wrong with them, or you're trying to, it can be very stressful, you know what I mean? To try to, so yeah, kind of that pausing, thinking what is wise, and kind of the gut check. Is this right for my dog? Is this the right best thing for my dog? Because really, there's you can go down so many rabbit holes. I'm sure you guys know, with so many different. You really have to it's almost information overload for our pet parents right now.
It's like, and the stuff they can dig up, it's like, in many cases, it's absolutely contradictory, and no wonder they're confused, and we get confused,
especially nutrition, right? Especially, I mean, it's told me it's up to 3 different doctors. They're paleo, vegan, Mediterranean diet. There's all, and that doesn't. We understand there's lots of different ways for humans, but for our animals, sometimes I think we want just like the right way. Like give me the right answer, and it is can be varied.
Yeah, and please, Jeff.
What is the right answer, Doctor?
Yes.
What the $1 million question?
The $1 million question. And so this is what my students, my coaching students, ask me all the time. And what I tell them is, what does the dog say?
Mm-hmm.
What does the dog tell you about what you're doing now? Are they happy with that? Is that working for them? And if not, then you need to pivot. No matter how bought into whatever the ideology is, if it's not working, it's not working. Mm-hmm. And that's really difficult for us, because we societally have evolved into camps of this and that and the other. And so, dear friend JJ Virgin, who runs a mastermind group for human healthcare practitioners, says if she can get a vegan, a paleo, a raw carnivore, and a keto person to sit down at a table and have a friendly discussion about nutrition, she considers that event a win. And I think that's the same thing for what's happening in our space. There's camps of this, camps of that, and for each camp, it's the right way. But the truth is that the dog will tell you that it's not the right way for them.
Right. Absolutely. I agree. And that happens, even I'm sure you guys in veterinary medicine too. There's, different, depends on where you went to school, depends on your background and, or your experience. I just really find that didn't work in my last 15 patients. So I'm less likely to use it on the 16th, like you do your experiences inform you. And there can be some different ways to approach it. And that's like, usually starting with like the wisdom of like, what can my dog, especially when it's something so urgent as food, because it's not like you can wait a week to mull it over. You got to feed that dog tonight, you know what I mean? And tomorrow morning. So you have to kind of have some, so I try to give a client, the clients I talk to, choices, have a couple, especially with digestion, because a lot of pet owners listening to this are thinking about, we're here because their dog has a digestion issue, right? So then we think about, I want you to have a couple different options of things. Maybe you've got some ground turkey in the freezer that you can pull out, a couple eggs that you can pull for when you need to change, then you have some choices and some options, and that can be very stress relieving, I find, because then they like, okay, I can do A or B, and then I can look at my dog, and they can help me kind of make the best
Right
decision.
on. Right on.
Yeah. But I
So-
think it's, sorry.
No, please.
Oh, I think it's also important that, especially with that, going back to that onslaught of information that's available, that we also sort of double check, why are we searching for more information and knowledge? Because I think a big aspect that we humans are dealing with is the lack of control, the feeling of lack of control that can drive us. And I see that a lot, especially with people, and, understandably so. So it's definitely not a judgment, but with animals, when they have animals that are not feeling well, so there's this fear that comes up that drives. And obviously, we still need to do research and do the things that are necessary to get the animal to feel better. But I think it's also good to kind of double check a little bit, why are we doing what we're doing? Because fear can be a very strong driver into a direction that may not be ultimately bringing that joy back, that Jeff was talking about. Then it also creates a bit of a separation from our animals, because if we're only focusing on their disease and what's going on and how to fix them, then we completely miss that heart connection that is there. And the animal is like, I'm here. So whenever you're doing researching,
Can we go for a walk?
and I think that's also an experience that a lot of patients, human patients feel, because their family then only focuses on the disease, and then they completely forget about the individual, and they all they talk about is that disease, whatever that is. And so I think it's good to kind of take a bit of a step back and, breathe through that fear and allow it to dissipate a little bit. And, that can be in different ways: meditation, just deep breathing, going for a walk, and gardening. That's what I did today a little bit, things that kind of take you out of that mode of having to,
Well said. I mean, I think that's a huge problem, is that we get turned into, as a patient, and I've been through some significant health challenges, you get the challenges is not getting turned into your disease, to maintain your autonomy as an individual and maintain your relationships. And that's difficult to do as a human when we can think our way through it. But I mean, I think that's what's so distressing for our pets with chronic illness, is they're like, well, I'm over here. I'm over
Yeah.
here. Come talk to me, please.
Yeah.
Get out of the box and shut that laptop, please, and come talk to me. So,
Yeah,
well,
they, oh, sorry.
yeah, please,
They,
Jeff.
they always say I'm fine. I mean, they're fine because they're in the moment. They're not worried about what they could be, what the label might say. Now, Dad, fear and trust. Fear of symptoms, because symptoms mean disease, mean, premature death, or not the best thing. It's all fear that motivates our actions in a lot of ways, if not in all ways. But if we trust balance of life that we know from thousands of years of research, and
and living.
the blue zones around the world are the longest lived people that are trusting the process of connection, happiness, engagement, all the things that we're talking about. And and like you said, the animals are all saying, excuse me, but I'm already doing that.
Exactly.
Our best teachers, if we let them.
Yeah.
So one of the things that can be challenging, and all of us here are early adopters in the holistic care. So we were out in the woo-woo before it became a thing. So what challenges did you face as you adopted more holistic options for your for your clients and your patients, essentially?
Ooh, can I go first?
Your eyes got big, Susan.
Oh my, it drives me crazy. Processed food. It dawned on me I think I was a vet for 7 or 8 years until I just thought, oh my God, it's all processed. It's all processed. You know what I mean? It was kind of, oh my God. And as far as the challenges was realizing that in my own, because trying to eat healthy in my own self and then looking at my much loved animals, because, vets, we all start with our own dogs and cats, right? We all, let's try this on mine first. And then if it, so I started there and thought, oh my God, I've been feeding processed food this whole time. And then going to my colleagues and clients and still getting the other veterinarians to see that this is processed food. We all know processed food is bad for us. We all know that. But to not see that for our pets is just, it's just amazing that it's still something that we don't understand. There was just recently, 2 years ago, one of the first studies that I've heard of in the US, and there's some in Europe, that actually linked processed food, cooked kibble, dry kibble, this was a study, dry kibble, and inflammation and decrease in immune function. Prior to that, the drop in interleukin-2 and the increase in tumor necrosis factor. And they saw that there's a link between, you feed the dogs whole foods and then you measure the inflammation. You feed the dogs, dry kibble, measure the inflammation 2 months later or whatever. And so that we're still there. That was my kind of, struggle with processed food thing.
Good thing is though, is that people are recognizing that it's not the best and that a lot of the advice that they're being given is not really the right one. I think there's a lot of waking up that's happening and
research
really amazing. Yeah. I mean, research for sure, but I think it's just people going back to what's logic and what makes sense. Because I mean, if you tell somebody you need to feed your kid Cheerios their entire life and you can never change anything, they would tell you that you're insane.
Right.
And that's what we do with, I mean, not me, but some of, the veterinary community is still telling people that. And that's just insane, and so people are waking up and they're like, doesn't make any sense. And I think that's, talking about the challenges with holistic medicine, I think that the biggest challenge that we're facing is in medicine in general is the logic. We have logical thinking for everything else. Car engine light comes on. We ask the question, well, why is it? We don't just take a piece of duct tape and put it on it. But with medicine, we've, logic has kind of gone down the drain. And even in the holistic field sometimes too, when, parents will ask, well, my dog can't jump on the sofa. What joint supplement can I use? I'm like, well, why is it that it can't jump up? Is it really a joint issue or is it something else? So I think that the most important part is to ask why before jumping. And I think that's kind of the challenge that I've been dealing with a lot in holistic medicine.
Right. Rather than looking for a quick fix.
Mm-hmm. Yeah.
Yeah. And that maybe that can answer your question in a sec, Ruth, but I think that might be, and I never thought about it before. Probably the first thing we start focusing on is called the HMDM, or holistic medical decision making, which is exactly what you said. It's a logical, without using the word logic, because logic, but it's easy and it's intuitive that you know what your goal is, do the research, see what's available, and then just do it. But
Right.
to answer your question, Ruth, in the 80s, I think the biggest obstacle was access. I think that when we began to discover things like omega-3s and antioxidants were good for animals the way they are for people, they were harder to find. There were no dog or pet supplements available. Now, of course, we go into the veterinary clinic, and every hospital I've been in recently is stocked with all the supplements, and I get emails about them all the time. But then, for me, the bigger challenge came in the late 90s when I realized that the physiologic paradigm physical paradigm that we learn in vet school only is about this big of the whole picture, that really we're alive because of energy, that without the energy and vitality in every cell in our body and every cell in our animals' bodies, they cannot operate, and that there are specific rules for maintaining, preserving, and maintaining that vitality, building up that vitality. And unfortunately, what we're taught, what we often do in vet school is, or as veterinarians, is lowering that cellular energy. And so whether it's with antibiotics, I mean, we often connected that anti is we're working against the body, we're working against the mechanism, but so be it. And that's why, when I discovered homeopathy in the late 90s, my eyes got open. My first question to Dr. Pitcairn was, why isn't everybody doing this? And yeah, I was very confused.
It is very confusing, and for me, I had a dog that showed me that whole food was the way, and so that was sort of the genesis of the crock pet diet. And then I found myself in the position of saying, I was wrong. I was wrong to tell you that that bag of food was the answer. Thankfully, well, just in terms of saving me humility and embarrassment, the first pet food recall happened. And so people were like, holy smokes, what do I do now? So we're passing out recipes left, right, and center in 2007. But that made me realize that most of what was coming out of my mouth on a daily basis was unexamined by me for truthfulness and veracity. And that's what this has been my biggest challenge in holistic care, is the willingness to look at, what am I saying? What am I thinking that is the way? And is it really? That's, yeah, that's a
I
tough
think we
one.
all go through that because we know what we know when we know it, and then when we know it, we do better, right? And
Exactly.
I think that's
Exactly.
also something that pet parents deal with a lot, and I think that's also where many of them get a little stuck in judgment and guilt and those types of feelings because, well, I mean, I've definitely had plenty of patients where I'm like, I wish I had known better. Looking back, I could have helped them more, and so that definitely is.
That's definitely, I definitely did a lot of that when I started doing recipes in whole food. I could have gone back and, all those, IBD dog comes in and you're thinking, well, inflammatory bowel disease, here's your, hydrolyzed protein. And you just, you do that for a couple of years. And then, I realized, wow, it's a struggle. So I know what you mean. Look, you kind of wish you could kind of go back. And once you find something that you find that is so valuable, that's kind of, I guess, the benefit of experience, huh?
Yeah.
Amen. And
Yeah.
being humble enough to say,
Yeah.
I was wrong. Here's what I think we should do now. And that's tough. And I think that's where many of our colleagues find themselves, is in this firestorm of trying to take care of so many patients and knowing in their hearts that it's not the right way, but they don't have the time or energy to figure out a different way. So that's part of why we do these summits, so that you, the pet parent, can actually help educate your veterinarian a little bit and bring them some different information.
Yeah. Definitely. But people play a big role in that, the education of others. So, yeah.
And the experience. I have a lot of times, when you'll have, when we get a dog, either they're home cooking or they decide to do our cheat dog diets. And then they said, I saw my vet and, their gut is so much better. My vet's like, wow, what'd you do? And then they say, well, we are actually feeding our dog food, and that can be, sometimes you're right. It works the other way sometimes. That the vets go, oh, I guess that did work. And then they are, more likely to try it with their next patient.
I think it's always going to go that way only. I don't think the vet paradigm, from what I've seen, is changing or going to change unless the pet parents get empowered as they are through the summit and yeah, And that's why the supplements started showing up on the shelves, because veterinarians, were hearing it from their clients. So yeah. And the same thing with the raw diet, same thing with food in general.
Because the vet wanted
Or
to
to
do
the
best
people.
for them. Yeah.
Yeah, change will come from people. That's for sure. It's all of you guys out there who are listening. You guys are the change. You're making a difference. We can only share information, but what you do with it, that's what really makes the change. So thank you, all of you out there.
Absolutely.
Yeah, amen. And one of the other things that that I find, like we were speaking about earlier, there's so much information out there. But in thinking about the topic you're presenting and sort of your specific little piece of the field, what do you feel is a very common misconception? So, Dr. Suter, if you could talk a little bit about the microbiome, that would be amazing. And then we'll kind of go through it. Everybody take a chance.
Yeah. I mean, a common misconception is that bacteria or, parasites or viruses are bad. But the truth is that I believe it's only 1% of microbes that actually are pathogenic, meaning causing disease. So the majority of microorganisms out there and in here are actually beneficial, and they do so much good. So I think that's probably the biggest misconception. And whether a microbe is more pathogenic in its way, how it operates in the body, depends on how the terrain is. A pathologist, he had done a lot of research in microbiology and that sort of thing. And he said that the standing water is what attracts the mosquitoes. So if the body isn't really that healthy, it's that terrain that's basically attracting these microbes, because in the end, we're all biodegradable. We all are born, and then at some point we go back to the earth. And so anytime there is something that's a little out of balance, then microbes come in to try to rebalance it out. And sometimes it helps, and sometimes, it leads more towards going back to the earth. But microbes play a big role, and they have been around for like 3.5 billion years or something like that. They have survived, they have evolved, they have created us, and they know how to go. So we just need to let them kind of lead the way and take us on that journey, basically, to greater health.
Dr. Jeff?
Well, I don't know if it's biggest misconception, but I did want to just play off what Odette just mentioned, because the germ theory, I think, is just plain incomplete, and that it's not the germs are even causing a problem. We're susceptible. Our animals are imbalanced, and the more they get imbalanced, the more they're susceptible, the more they're liable to get sick from any germ. I mean, that's why we've got sickness from staph. That's why we get sickness from yeast. Well, these are microbes. These are microorganisms that are normal parts of our body, like you said, Dr. Odette. 99% are not even pathogenic. But again, Dr. Staph aureus about that MRSA, which has killed many, many people because they're susceptible, because they're imbalanced. But I think, going back to your question, Dr. Ruth, I think the biggest things, and there are two, I guess, that are interrelated, is one, our genetics, our animals' genetics is just one little piece of the bigger picture. And that it's what we're able to do with our environment, with our love, with our food, that turns on or turns off genes. That's really more important, and that it's an energetic and not a physical. paradigm that we play in, that we need to be immersed in, that all this information about physical stuff is great, it's important, it's useful, but it's just like genetics, it's just a piece of the bigger picture.
Yeah.
Dr. Susan, how about you? What do you think is a big misconception?
Okay, well, I'm going to make them short, but I have two short ones. One is that we think, especially with digestion, since that's our focus in this summit, is that and I'm sure you guys understand that things are not related. That, oh no, my dog's gut is fine because their poop is fine, but it's the skin. It's just the skin. So I need a shampoo, right? Or my dog's gut is fine, but they have all this anxiety. And so I just need an anti-anxiety medication. It's like that idea of like, but not seeing the connectedness. Now we're starting to understand the gut-skin axis. And they'll talk about the brain-gut axis. These things are all related, so understanding that they're really not that, when you have one problem, you have to like throw out everything and, try to fix every single part of your body, but more that understanding that specifically digestion is part of the skin, is part of, the mental, is part of the brain, is part of how, what kind of inflammation we're going to have in our joints, and are we going to have arthritis. It's all that it's connected. It's just the sort of that we try to separate them into different boxes, and as Western medicine tends to do that. And so it's really nice that holistic medicine kind of understands that these things are connected. So that my one misconception is that you could separate them. And the second one, more related to digestion specifically, is the idea that, well, my dog could eat whole foods until they got, a problem, and now they have to go on this, kidney diet, or they have to go on this, whatever prescription diet. And so understanding that there is other ways to approach it, to try to gain balance. Like we see, I'm sure you guys have so many pancreatitis dogs, who aren't eating their prescription dog food because, and then being able to get them on a whole food and do better. It's, so exciting because we're trying to understand that, it's not that, you have to have a bad with the dog, with the condition of the dog on the label, and therefore it will get better. So that's kind of another misconception, I think, that they have to stop feeding whole foods if there's a condition.
Amen. And as we're wrapping up this panel, and this has been a ball, y'all. I mean, I told you we were chatting before, and it's been a stressful week, and I feel my energy so elevated by this conversation. So thank you. But as we're wrapping this up, can you offer one piece of advice or thought for pet parents that are interested in holistic care? Maybe they're starting completely from scratch. They know that what they've been doing isn't working, and they're looking for answers. What one piece, where would you advise them to start thinking or doing?
I would
Easy
start
question.
with get a mentor, because I've had in my journey of getting back to health, I've spent thousands and thousands of dollars on trying to figure it out. I did 2 years of Chinese medicine and herbs and acupuncture. And then I did therapy to, spiritual, whatever, to kind of clean out some of my energetic things. And then I did this and that. But it's like, it wasn't until I brought all the pieces together that things really changed. And I spent so much time. I spent 10 years basically pretty much flat on my back because I had so much fatigue and I could barely move. And animals don't have that time. So my recommendation is get a mentor, work with someone that you gel with, that you feel like has some information, has some experience, and can help you and show you kind of more of a shortcut so that you don't have to go that winding road and maybe never get to have your animals feel better, because that's just a miserable life for you, for your animals, for your family, for everyone. So that's my recommendation. And I know that costs money to have a mentor, but in the end, I think you're going to save a lot of money because you're going to have a happier life. You're going to be able to have more joy and have more rewards, and you'll learn more for yourself as well, because most of us, whatever we teach for the animals applies to humans just as much. So, you get like a 2 for 1 or 1 for 2.
Well
Anyway,
said.
that's my recommendation. Don't wait, just go for it.
Right on.
And,
A health BOGO.
and
Right on.
I would like to jump in just to say that what I think would be better is a community of mentors, a bunch of like-minded people that can support you when you're not necessarily, working one-on-one with somebody, but
Like the summit.
exactly. Yeah. To answer your question though, Dr. Ruth, I think the number one thing that I would have to focus on is embracing symptoms like friends that embrace those symptoms in order to focus on what's important, which is quality of life and health span. And there are specific ways to be able to do that. We say focus on the beam, or beam is like the balance beam, or it's like the tractor beam in Star Trek that will pull you to health. Beam is behavior, energy, and appetite and mood. When those things are optimized, don't worry about the red hair, don't worry about the pre-Cushing's, don't worry about the label. So the diagnosis of the disease, symptoms are your friends, embrace them like a friend.
Well said.
So I'll do our last, one sort of thing to do, I would suggest is put some, tonight, the next meal for your dog, if you haven't already tried it, if you haven't already done some real food, cook something, cook it. It's always more gentle to cook rather than to feed it raw. But if you want to take some meat out of your fridge, or like I said, some egg or sweet potato can be great as a starter. If you're kind of like, I just want to try something. But it can be so gratifying to put some, to cook some real food and put it in your dog's bowl. It feels really good. And the dogs love it. Cats too. You can just cook a little bit, a little bit of goat's milk or a little bit of egg in the fridge. Just something real in their bowl is really important.
Amen. So for all of you listening, if you got nothing else, don't trade in pills for supplements. Instead of looking at what supplement can I use to treat shoulder arthritis, look at why is the shoulder arthritis and what's underneath all of that first. Obviously, provide relief where it's needed so that there's no suffering, but look at the underlying question. And I think what I heard all of you say is, and this is difficult for us in the way our society is structured today, but look at things in terms of holism and connectedness. So really, if we can begin to approach that idea that all of it is connected, and it doesn't matter what modality you're looking, epigenetics, biome, homeopathy, Chinese medicine, Ayurvedic medicine, these are all means to an end of reestablishing balance and wholeness within the individual, within the biome of the person or the animal. So this has been an absolute ball. And so for those of you that will be attending the summit, you can go listen to Dr. Jeff Feinman's talk. You can listen to Dr. Suter and I's conversation and Dr. Susan Bohrer's talk on all of these amazing topics. The summit is starting tomorrow. So if you're not signed up, click that link down there, get signed up. We will have live Q&A sessions starting Monday, April 29th at 6 p.m. Eastern. And the other thing I want you to make you aware of is I'm going to be giving a little webinar about one of the more common issues. And again, here I'm talking about wholeness, but one of the common issues in veterinary medicine, which is kidney disease, sadly. It's a very common thing. I think mostly it gets confusing when you go to the vet. You get handed a sheet of paper with numbers on it, and the vet says, "Oh, your dog's in early kidney failure," and your dog's fine. So what do you do with that? So that's my goal, is to give you some information there about how to sort through that information, how to start making decisions based on what's going to bring everything back into wholeness. So again, Dr. Jeff, Dr. Odette, Dr. Susan, it has been an honor and a pleasure talking with you all.
Well, thank you. And thank you, everyone who's joining in.
Thank you all for your time, and thank you, Ruth, for being an awesome, awesome moderator. So thank you.
It was a lot of fun. We really appreciate you guys.
Yeah.
Thank you so much.
Great.
With pleasure.